This is the front lobby of Women's Hospital, and as you see, we got a nurse or a nurse practitioner that will be here 24/7 screening patients and visitors to make sure that they're not ill. As you come in, you'll also see the security desk. That's where we get visitors' passes. Right now, the visitation is restricted, and you can have one visitor per patient per hospital stay, and they will get screened and they will get tagged. As you come in, you would come to the admissions desk and notify the admissions clerk your reason for coming to the hospital, and they will notify labor and delivery for you to head back. Then we're going to head back to labor and delivery suite, and the first stop is always the emergency room, the OB/ED. And that's in order for them to assess you and triage as to whether or not you will need to stay. So you come through the door to the OB emergency room, and we'll take a peek at those bays. There are 8 bays back in the emergency department. We have hospitalists on duty 24/7, and they are here to assess you, and sometimes you might be back here several hours to determine whether or not you're going to be staying. And once they decide that they need to admit you, you will come to a labor and delivery room. So we'll come out, and this is in labor and delivery. And we're going to go down the hall to a labor and delivery room. This is one of our labor and delivery suites. As we walk in, you'll see the labor and delivery bed itself. The bottom third of this bed breaks away and also has stirrups that they can put up for you during pushing phase and delivery. All of the equipment is right now kind of hidden away to make it a little bit more homey, but the fetal monitor is here, and when you come in, they'll be putting the fetal monitor belts on your abdomen to assess the baby's heart rate and to watch the contractions. And your nurse may be taking care of 2 patients while you're in labor. And once you get to the pushing phase and delivery, if she has a second patient, someone else will take care of that patient, so she can be primarily right here with you to coach you. This is the bathroom. All of our labor and delivery rooms have their own bath, but as you notice, once again, they're showers only. After your baby is delivered, or let me start by saying your baby, when it's time for delivery, of course, the doctor will come in with his tool, usually an OB tech. You'll have your labor and delivery nurse, your support person. So there'll be a lot of people in this room. And then once the baby is born, we still celebrate the golden hour, and your baby will be put skin to skin on mom's chest to transition to extrauterine life. It's a precious time to get to know that baby, and it helps stabilize the baby's temperature and blood sugar and heart rate, and helps them to adjust to being outside the womb. Usually you're here about an hour to an hour and a half after delivery to make sure that the baby has adjusted well, and if you're planning to breastfeed, which I hope you are, then your baby, we're going to leave without disturbing, as long as their heart rate and color and temperature and everything looks good. We're going to leave them on mama's chest until they complete that first meal, that first breastfeed, and until mom gets stabilized with her vital signs and her bleeding. And then both mom and baby will be moved out to the mother-baby unit.